In this video, we are going to see about how the parallel beam reconstruction has been made in the CT. Okay, in computer tomography, the parallel beam reconstruction, how it is being made is seen in this. We are going to see in this video. Okay, parallel beam reconstruction. Parallel beam reconstruction is a technique used in the medical imaging. Okay, parallel beam reconstruction is a technique which is used in the medical imaging, particularly in computer tomography, that is CT, and some other imaging methods. Okay, parallel beam reconstruction is a technique used in the medical imaging, particularly in the computer tomography, that is CT, and some other imaging methodologies. It refers to a method of reconstructing a two-dimensional or three-dimensional image from a set of projected data acquired. Okay, this image reconstruction is made by the combination of the set of data projected, whether it can be of two-dimensional or three-dimensional data. From that data, we are going to reconstruct the image by using the parallel beam reconstruction method. Okay, parallel beam reconstruction is a technique which is used in the medical imaging, mainly used in CT imaging techniques. This is called parallel beam reconstruction method. We have source and a detector. Okay, detector and a source, from where the source is going to pass the rays into the detector. Okay, the rays is going to pass or touch the detector. It will be in the parallel direction. You can see the arrows which is parallel to each other. Okay, this process is called as parallel beam reconstruction. Okay, historical content. A history of parallel beam reconstruction is intertwined with the evaluation of CT imaging techniques. Okay, this parallel beam reconstruction is intertwined with the evaluations of CT imaging technologies, which has revolutioned medical diagnostic and treatment plannings. Okay, it remains a fundamental technique in the medical imaging. This parallel beam reconstruction is being a fundamental technique in medical imaging, allowing clinicians to obtain detailed, non-invasive and cross-sectional view of the human body for a wide range of medical applications. Okay, this technique, parallel beam reconstruction technique, is a very foundational imaging technique, which is very fundamental one, and this allows the clinicians to obtain detailed, non-invasive and cross-sectional views of a human body for a wide range of applications. Okay, next, working principle. A parallel beam refers to a specific arrangement of X-rays or radiation beams used in the medical imaging, particularly in the computer tomography. This parallel beam refers specifically arranged in a parallel manner. Okay, where all the rays will be in parallel to each other. In a parallel beam configuration, the X-ray or radiation source emits a beam of radiation, and the detector or sensor arrays are positioned directly opposite to the source. Okay, as I told you already, the source and the detector will be in opposite to each other, where in parallel ways the rays will be passing on it. Okay, what are the equipments we have in the parallel beam reconstruction is that X-ray sources. Okay, where the source, X-ray source, the rays will be passing from source to the detector. Okay, source to the detector. This is the primary source of an image reconstruction technique. Next, is patients or object, where we are going to measure or we are going to detect the patient's body. So we require patients in this. Okay, first we are going for X-ray source, and then the patient, and then the detector. Okay, by using patients we are going to measure the X-ray of a patient. The patient or object being imaged in the position between the X-ray source and the detector. The X-ray passes through the patient or object and are partially observed or scattered based on the density and composition of tissues they encountered. Okay, since the rays passes from X-ray source to the patient, the part which where we are going to scan, that part will be exposed with a large amount of X-rays. Okay, next is parallel beam geometry. In a parallel beam configuration, the X-ray beam emitted by the source remains parallel as it travels through the patient or an object. This means that the rays of radiation maintain a constant direction and do not converge or diverge significantly. As I told you already, this is a parallel beam reconstruction technique. This rays will be in the parallel position only. They will not have any divergence or convergence in their path. Okay, next is detector. On the opposite side of the patient or an object from the X-ray source, as I told you already, that one will be a detector. There is an array of detector or a sensor elements that captures the X-ray that passes through. Okay, next is multiple angles. Okay, to create a cross-sectional area of a patient's internal structures, multiple X-ray projections are required. Okay, to create a cross-sectional, we are going to measure the cross-sectional view, three-dimensional and a two-dimensional images, right? So we are going for cross-sectional imaging techniques. Okay, this is achieved by rotating either the X-ray source and the detectors around the patients. The source and the detector will be rotating around the patient to take a cross-sectional image. Okay, projected data. Each X-ray projection represents a two-dimensional view of a patient's internal structures from a particular angle. Okay, next we are going to reconstruct the image what we have captured, right? To create a three-dimensional or a two-dimensional image from these projections, mathematical algorithms like a random transform or a filtered back projections are used. To reconstruct the imaging techniques, we are going to use the mathematical algorithms like a random transform or a filtered back projection methods are used. Types of parallel beam reconstruction: fan beam reconstruction, cone beam reconstruction, and helical and spiral reconstruction. Okay, fan beam reconstruction, cone beam reconstruction, and helical and spiral reconstruction. These are the types of parallel beam reconstruction. This is a fan beam reconstruction. From the image you can see that it will be rotating. Okay, how the fan rotates, as such the source and the detector will be rotating. Okay, next is cone beam reconstruction. Here also from the beam you can see that the source, the detector will be rotating and the source will be in of cone shaped. Okay, cone shaped detector and source will be there. So this is named as cone beam reconstruction. Next is helical and spiral reconstruction, where the X-rays will be passing in the spiral form or in the helical form. Okay, the X-ray will be passing through the patient in the helical form or in the spiral form. When comparing to the conventional CT scan, the helical CT will perform a very fast process. Will be a very fast process and a quick process to detect the images in the body. Thank you.